kinesiology major from Woodbridge, Virginia.
Hi, my name is Kayla Davis. I'm a freshman kinesiology major from East Orange, New Jersey.
Hi, my name is Carl Moore. I'm a psychology major from Vallejo, California.
Our topic is on emerging diseases. What is an emerging disease? Emerging infectious diseases are infections that have recently appeared within a population or those whose geographical range is rapidly increasing or threatens to increase in the near future. Emerging diseases can be caused by previously undetected or unknown infections.
I'm going to be talking about pertussis, which is also known as whooping cough. It is an emergent disease that first emerged in the 1920s and 30s. It is a highly contagious respiratory disease that is caused by the bacterium Bordetella pertussis. A person that is showing signs of having whooping cough has cold-like symptoms, which are a sore throat, runny nose, congestion, along with a cough. In most cases, the host will have a fever. This develops into serious coughing attacks that may produce a void between coughs that makes it hard to breathe. I have a personal story about that. My brother, he actually had a whooping cough and it was disgusting. The disease can affect people of all ages, but can be very serious and fatal to babies under the age of 1 year old. He actually had it when he was 8 months, so that was very bad. The best way to protect against the pertussis is by getting vaccinated, even though the scientists believe that the vaccination blocks the disease, but not the transmission. Rohani et al. Saw that the vaccination of the babies also actually decreased in transmission to adults, and also observed that the rates dropped in babies who were too young to get vaccinated.
Alright, so I'm going to be talking about two viruses, and the first virus I'm going to be talking about is the Ebola virus, and it was first identified in 1976, and over the global estimated cases, there were over 18,000 cases, and global estimated deaths were over 7,000. And the Ebola virus starts with a high fever, headache, sore throat, and lack of appetite, with muscle and joint aches, vomiting, diarrhea, and a rash that follow the initial symptoms for about 3 days. And after 3 days, roughly 50% of the Ebola disease patients begin bleeding both internally and externally. And as of 2014, Africa was the only continent to experience the outbreaks of the Ebola virus. The 2014 epidemic was the largest and longest and most deadly Ebola outbreak on record. In August 2014, the Democratic Republic of Congo in Central Africa declared that a different strain of the virus had came out and had killed at least 2 people. And the U.S. Center of Disease Control maintains that there are no actual significant risk of people from the United States for it to flare up in the United States. And the CDC established safety measures for people who have Ebola and are brought to the United States for treatment.
The first disease I will be talking about is called SARS disease. SARS is a viral respiratory illness caused by a coronavirus. SARS was first reported in Asia in February of 2003. The illness spread to more than 24 countries in North America, South America, Europe, and Asia. SARS was contained in 2003 and was reported to have no sources of outbreaks of the disease in 2004. How can you receive it? Sharing foods, drinks, hugging or kissing, close contact with an infected person, tiny droplets on your hands by touching contaminated surfaces or objects, and then proceeding to touch your eyes, mouth, or nose. The symptoms of SARS is dry cough, shortness of breath, a fever, or difficulty breathing. You also might have constant headaches, muscle aches, sore throat, fatigue, and diarrhea. Older people may feel generally unwell and constantly lose their appetite.
Okay, so I'm going to be talking about the H7N9 virus, also known as the bird flu. And there have been over 400 global cases identified and over 200 deaths identified. And the virus has been found in birds and in China and in other areas where the birds have infected people, where it's been identified that if they're in the bird's habitat, you can get infected that way. And after eating the poultry from the birds, you can also be in contact with it. And human infections with the bird flu virus are rare, but have happened in the past. And usually, after close in contact with the birds, both live or dead in their environments, you can catch the bird flu virus. Infected birds can shed a lot of flu virus, for example, in their droppings or in their feces. If someone touches the infected bird and then touches their nose or their mouth or their eyes, they can become infected with the bird flu virus.
The next virus that I will be talking about is the rotavirus. It is one of the most common causes for diarrhea in infants and children. Rotavirus is a virus that infects the bowels, causing inflammation of the stomach and bowels. This is a highly contagious virus. After about 2 to 3 days, it should dissipate, but it usually doesn't, and it is the cause of 500,000 deaths of children worldwide annually. Signs of having rotavirus are fever, vomiting, and watery diarrhea. And there are vaccines to get rid of the virus. They're Rotatec and Rotatrix. When I was younger, I actually had rotavirus, and it's very painful and it is very disgusting. I had a fever and I did have all the symptoms, and it was one of the worst things that I had, but I got over it.
The next disease I will be talking about is called the Zika virus. The Zika virus is the arthropod-borne flavivirus transmitted by mosquitoes of the Aedes type. The virus that causes the disease was first isolated in 1947. The first documented outbreak among people occurred in 2007 in Micronesia. As of January 2016, the disease has been occurring in 20 regions of the Americas. It is also known to occur in Africa, Asia, and the Pacific. This disease causes Zika fever, a self-limited febrile arthralgia syndrome closely resembling dengue fever. Most often signs and symptoms are maculopapular rash, fever, headache, and conjunctivitis. Sore throat, cough, and vomiting occurs less frequently. Zika fever is mainly spread via the bite of a mosquito, but can also be transmitted sexually as well as through blood transfusion. Infections in pregnant women can be spread to the baby.
Alright, thank you everyone for watching this video. In conclusion, the point of this video is to try to spread awareness about up and coming diseases, because even if you don't know about them, you should check up and check the social media and all different media platforms of the different infectious diseases that you can catch, because even if they're not talking about them and you don't hear a lot about them, they could still be in your area. So make sure you go to the doctor and check for any diseases that you may be able to catch. Thank you.